Now, the monsoon may be over, but in the aftermath, an outbreak of dengue has spread across the country with thousands suffering from it. Hospitals are overloaded with patients and are struggling to cope. In many hospitals, patients are being treated in the emergency wards, and in many others, only those with critically low platelet count are being admitted. Okay, we're joined now by Dr. Romil Tekusa. Thank you for joining us. He's an senior consultant of internal medicine at Max. Let's move in straight away to our first caller on the show. Sir, go ahead. You have a question for the doctor.
Okay, madam. Okay. Madam, I'm Murthy calling from Tamil Nadu.
Yes, sir. Go ahead with your question.
Yeah. See, I'm calling from Tamil Nadu. See, what are the common identifications can be found on the part of the person who is affected by dengue?
What's the question?
Sorry, sir, could you just repeat that question?
Yeah, see, how does the dengue fever differ from other common fever?
Right. I don't know if you understood that question, but basically he's asking how does it differ from other normal fevers?
I understood the question. See, initially, all fevers will behave similarly, or infections. It's a flu-like illness initially. In the first 3 to 5 days, even with flu, you'll have high fever, body ache, backache and stuff like that. But you'll also have a sore throat and other symptoms that go with it. But in dengue fever, initially it's very difficult to differentiate whether it's dengue or whether it's flu or any other fever, because the symptoms are pretty much common to all of these infections. The only way you can find out in the initial 3-4 days is by doing a blood test. The rash, the platelet count, it comes much later, after 5 days. So initially it's just the blood test, and initially there's nothing much you have to do except drink a lot of water and take paracetamol.
But doctor, I think what many would probably want to know, at what point should they start worrying, and at what point should they go ahead and get that blood test to figure out whether they've actually got dengue or it's just a simple fever?
Well, you can wait for initial 2 days because nothing happens during that time. Especially the first 5 days, the complications don't happen. So after 2 days, if the fever doesn't go, then you can get in touch with your physician, get a blood test done. There's a dengue NS1 antigen test, which can come positive on day 1 also. So initial 7 days, that's the test we do, and much later comes the serology test. But if you have a look at the CBC, which is a complete blood count, you can have certain indications from there as well, like a low white cell count, and things like that tell you that it could be dengue.
Yeah.
Symptoms, there's nothing much to differentiate actually in the first 3 days.
Yeah. But if the fever remains high, or if you continue
fever
to
remains
feel
high
unwell,
and it goes, all of a sudden after 4-5 days the fever goes, and the patient
also
actually,
I suppose there is a time period really for the breeding of the mosquitoes, etc., which is, like we said, in the aftermath of the monsoon.
Yeah, see, the problem with dengue is once the fever goes, the patient feels he's getting better, but what actually is happening is that the platelet count falls after that, and that's when they should be more vigilant towards dengue.
Right.
Because I'm not talking about plain dengue fever, which happens to 80% of people.
Yeah.
They don't have complicated dengue. Complicated dengue happens to very low proportion of patients.
Yeah.
And they're the ones who develop dengue hemorrhagic fever, where the hematocrit goes up, you're dehydrated, the plasma leak happens, fluid comes into the abdomen, in the chest, and they're the ones who might bleed because the platelet count falls. They're the ones who we should be vigilant towards. They should be admitted if they are very critically low platelet counts, and if they are dehydrated. If they are drinking enough water at home, there's nothing much to be done except to maintain hydration, adequate urine output.
Okay, well, of course, interestingly, doctor, we're seeing this year that literally, like we said, the hospitals are flooded at the moment with patients. Half the patients who are coming in the OPD are actually dengue patients suffering from dengue. We know that 70% of patients who are actually suffering from fever are suffering from dengue fever. Is there a particular reason why we're seeing such a large number of patients this year?
Well, it's pretty unusual this year. It usually happens post-monsoons every year. September, October is the peak season. But this year we didn't see much of dengue in the month of September. It suddenly started in October, and with a vengeance, a lot of patients. So probably the reason being maybe the rains were a little late this year, didn't happen in August, and happened more in September. So that's the reason probably.
India's #1 news app just got even better. Download NDTV's new app. Fully optimized for retina display. Full screen view. Faster response time. And Sudoku. NDTV's new iPad app. Download now.